Cubital fossa. Features situated on the front of the elbow. It is homologous with the popliteal fossa of the lower limb situated on the back of the knee. Boundaries laterally. Cubital fossa cubital, Latin cubitus, elbow, fossa is a triangular hollow medial border of the brachioradialis, figure 8.14. It is directed downwards, and is formed by the area where brachioradialis crosses roof A. Skin joining the cephalic and basilic veins. The lateral cutaneous nerve of the forearm lies along with C-deep fascia floor it is formed by. Contents of fossa is actually very narrow. The contents described are seen after retracting the boundaries. From medial to the lateral side, the contents are as follows. 1. The median nerve. It gives branches to flexor carpi apex the pronator teres muscle. The roof of the cubital fossa, figure 8.15, is formed by b. Superficial fascia containing the median cubital vein cephalic vein and the medial cutaneous nerve of the forearm along with basilic vein. I. Brachialis, figs 8.16a and b. E. Supinator surrounding the upper part of radius radialis, palmaris longus, flexor digitorum superficialis and leaves the fossa by passing between the two heads of pronator teres, figure 8.18. D. Bicipital aponeurosis. The ulnar artery goes deep to both heads of pronator teres and runs downwards and medially, being separated from the median nerve by the deep head the posterior ulnar recurrent, and the common ladder gives off the interosseous recurrent branch. 3. The tendon of the biceps brachii, figure 8.17. Of the pronator teres, figure 8.19. Ulnar artery gives off the anterior ulnar recurrent, interosseous branches, figure 8.10. The common interosseous branch divides into the anterior and posterior interosseous arteries and 4. The radial nerve. It descends medial to lateral epicondyle to enter cubital fossa. In the fossa, it gives of the radial nerve which gives branches to extensor capri radialis brevis and supinator. Then it leaves the remaining superficial branch runs in the front of forearm for some distance. Off the posterior interosseous nerve or deep branch of fossa by piercing the supinator muscle, figure 8.18. Clinical anatomy. The cubital region is important for the following reasons. A. The median cubital vein is often the vein of choice for intravenous injections, see figure 7.8. It is used for introducing cardiac catheters to get sample of blood from various chambers of heart. B. The blood pressure is universally recorded by auscultating the brachial artery in front of the elbow, figure 8.11. The anatomy of the cubital fossa is useful while dealing with the fracture around the elbow, like the supracondylar fracture of the humerus.